Collecting sterile specimen from indwelling catheter.
So, good afternoon. I'm Jamie Bervana and I will be performing the collecting sterile specimen from indwelling catheter. So, the first thing that you need to do is, of course, you need to assess the patient. But before doing that, you need to introduce yourself to the patient. So hi ma'am, good afternoon. I'm Jamie Bervana, student nurse for today. So, may gagawin lang po akong procedure sa inyo. Pwede po ba iyon? Okay po. Kukuha lang po ako ng ihe para mapatest po sa ating laboratory. So, after saying or after telling to the patient what is the procedure that you're going to do, the first in assessment, you need to assess the client's ability to cooperate with the procedure in order to determine how the procedure to be carried out. Then next is you will assess the working area if it is well lit. So, as you can see, it is working area and it is well lit. It is in order to determine what preparation needs to be done, and of course you need to ensure the successful procedure as well. So, going to planning, the first thing that you need to do in planning, you need to gather all your equipments that you needed for the procedure. The first thing you need is the gloves, the specimen container, the needle or the syringe with 1 inch and 10 ml. So, going to planning, of course, you need to prepare all your materials that needed. It is in order to, when you organize the materials, it is being easy access during the procedure. So, the first thing that you need is the non-sterile gloves, this syringe with needle in 1 inch and 10 ml. And then, of course, the container for specimen or specimen container, the povidone, iodine, and swabs, and last is the plastic bags and labels. So, proceeding to the implementation, the first thing that you need to do is, so you need to identify the client and explain the procedure and what is the purpose of doing it. It is in order to alleviate the anxiety and gains the cooperation of the patient. So I will provide the privacy by closing curtain and closing the door. So, it is in order to protect the client's dignity. So, the next one is, of course, you need to wash your hands in order to prevent the cross-contamination to the patient or to the client. Then, after washing your hands, of course, you need to check the tubing or the urine tubing. So, the rationale for that, it is in order to determine if there is sufficient urine in the collecting tubing for specimen. So, the urine from the collection bag should not be used for sterile specimen. The next is, if more urine is needed, you need to wait for 10 to 15 minutes and you need to clamp the tubing. It is in order to collect the 10 ml urine which is needed most urinalysis. The next is you need to check the urine in the tubing. So, I will check for it. So, why do you need to check it? It is in order to determine if there is sufficient urine in the collecting tubing for a specimen. So, the urine from the collecting bag or collection bag should not be used for sterile specimens. So, after checking the tubing, the next thing you will do, if you need more urine, you need to plump the tubing and wait for 10 to 15 minutes. So, I will plump the tubing. So, after clumping the tubing, you need to put gloves in order to clean the sample port with povidone iodine. So, I will clean the sample port. And I will discard it and let it dry. So, after that, you need to insert the sterile needle and syringe into the sample port or the catheter at the 45-degree angle and withdraw the 10 ml urine. So, I will get the urine. Okay. And then withdraw into the container. Why do we need to insert the needle at a 45-degree angle? It is in order to obtain the specimen with sufficient volume and most urine tests. After I put the urine into the sterile container, of course, you need to remember that you need to close it tightly in order to take care of it and not to contaminate the container. So, the rationale for that, it is in order to prevent contamination of specimen and spill of the urine. So, after that, you need to remove the clump and rearrange tubing, avoiding the dependent loops. So, I will remove the clump and I will back it to the original position in order to prevent or to avoid the dependent loops. After removing the clump, the next thing you will do is put the specimen container in the plastic bag and send it to the laboratory. Put label on the specimen container and I will put it inside the bag. So here is the urine and put it in a plastic bag or in a bag. It is in order to ensure the right and controlled transfer of pathogens. So after that, you need to remove the gloves and of course wash your hands. Wash your hands after that in order to reduce the transmission of microorganisms. So you need to document the procedure that you've done to the patient in order to determine the assessment findings. So the rationale for that, it is in order to have an accurate date for collaborative management and continuity of care. So I will get back to the patient and I will protect her privacy as well. Okay, so thank you ma'am for your cooperation.